It's an irreplaceable resource. Whenever I go out in public, people say, we love the hospital. Nothing's going to happen to the hospital, right? People have their babies here. Their end-of-life issues are here. They receive care in our emergency room. Their kids go to school together. It's that community flavor. Because we are small, I mean, we sort of have a model of 3 feet and greet. So when you walk down the hall, if you get within 3 feet of someone, you're expected to say hello.
Kendra Aucker is the president and CEO of Evangelical Community Hospital in Lewisburg, Pennsylvania. Prior to the introduction of the Affordable Care Act in 2010, the hospital was feeling the pinch.
Before the ACA, there was no mandate to have insurance. In Pennsylvania, there was a growing number of uninsured individuals. There was a lot of talk and concern by individual consumers about the fact that they could not get health insurance because of pre-existing conditions. And in our world, the ER was the de facto place that you went for your care if you did not have coverage. Spending on health care was increasing 2 to 3 times the inflation rate. At Evangelical, our bad debt write-offs for un- and underinsured, as well as our charitable care, is about $11 million a year. That number kept increasing. And so hospitals are always tasked with seeing people regardless of their ability to pay.
While there are certainly mixed feelings on the Affordable Care Act, Aucker says it has had positive effects on Evangelical Community Hospital.
Now there is an individual and employer insurance mandate, so you have to get coverage. That was a huge improvement for us. There was also a huge investment made in IT and technology. So the system previously had been based on this paperwork craze, and so money was invested in information technology and technology in general, being able to tap into the things that were taking place. And you moved away from that notion of only coming here when you're sick. And the payers moved to that notion of value, and that as hospitals you began to be penalized in Medicare, for instance, if you're readmitted within 30 days for the same thing as you left. So began to really rework the systems. And for the first time, the cost of this kind of went down as the number of people who were insured went down. So there were a lot of really positive things that happened, and our charitable care and bad debt kind of leveled off.
Now, with the future of healthcare in question, Aucker finds herself wishing she had a crystal ball.
We still are independent, and we have these loose clinical type affiliations. We're not formally aligned with any one person. I don't know how long we'll be able to walk down the middle of the road. But for now, we are maintaining our independence. I realize we're somewhat of an anomaly in healthcare right now, and I attribute that to an incredible medical staff, to an incredible workforce, and the community. The community loves this place. The proof is there that it is the community that has supported this, but it does keep me awake at night worrying at times, whether that's going to be able to continue. We will just continue to take care of people.